Good morning, and welcome to our Alaska Collaborative on Health and the Environment teleconference, titled Ensuring a Healthy Environment for All Children, the Need for Research, Policy, and Urgent Action, with Nsedu Obot Witherspoon. My name is Diana DeFazio, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. CHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. CHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. And you can find more information at akaction.org and healthandenvironment.org. You all should have received a link to a PDF of the PowerPoint presentation. If you don't have that document in front of you now, you can download it at akaction.org. Just scroll down to the bottom of the post about today's call and you will find the link. You'll need to download the PDF of the PowerPoint in order to follow along. And our speaker will be saying next slide periodically just to help you move through it. A number of our calls this summer have focused on children's environmental health in anticipation of the Children's Environmental Health Summit that Alaska Community Action on Toxics is convening on October 5th and 6th at Alaska Pacific University in Anchorage. You can find out more about the summit and how to register on our website at akaction.org, and we'll be giving you a little bit more information towards the end of the call as well. Now it is my pleasure to welcome and introduce Nsedu Obot Witherspoon, who is one of the many experts, health professionals, and community leaders who will be speaking at the summit in October. Nsedu Obot Witherspoon is Executive Director for the Children's Environmental Health Network. For the past 14 years, she has served as a key spokesperson for children's vulnerabilities and the need for their protection, conducting presentations and lectures across the country. She is a leader in the field of children's environmental health, serving as a member of the Institute of Medicine's Environmental Health Sciences Roundtable and co-chair of the Leadership Council for the National Conversation on Public Health and Chemical Exposures. She is a member of the Friends of the Columbia Center for Children's Environmental Health and a strategy advisor for the California Breast Cancer Prevention Initiatives Project. Ms. Witherspoon is also a board member for the Pesticide Action Network of North America and serves on the Maryland Children's Environmental Health Advisory Council. She's also a recent recipient of the William R. Riley Award in Environmental Leadership from the Center for Environmental Policy at American University. Ms. Witherspoon has a Bachelor of Science in Biology, pre-med from Siena College, and a Master's in Public Health in Maternal and Child Health from the George Washington University School of Public Health. She is the mother of 4 children and a passionate advocate for all children today and tomorrow. And welcome, Nsedu. You may go ahead and begin.
Thank you so much, and I really want to extend a warm thanks to you and AK Action for this gracious invitation. So happy to be here. I will do my best to remind myself to say advanced slides, but if for some reason I'm getting behind, if you could just remind me, that would be great. So next slide. This first slide. Sorry?
Yeah.
Okay, so now we should be on protecting our children. Okay, these are some of the quotes that help to keep me focused at times. Our office is in Washington, D.C., and it can be an interesting town at many times, especially during an election year. And it's always nice at times for those harder days when you don't really feel that people are putting children front and center, as many claim that they are in the U.S., to kind of go back to some of these. So Nelson Mandela, the former president of South Africa, there can be no keener revelation of a society's soul than the way it treats its children. I find that to be very grounding. Herbert Hoover, our past president, children are our most valuable resource. And of course, our wonderful EPA administrator, Gina McCarthy, the public health community's voice has always been vital. With climate change, our obligation to speak for children's health and to act to protect it is as clear as ever. So just a little framing here as we get going. Next slide, please. So here, this slide, Grand Canyon. Next slide. It says our environment on top, some other beautiful landscapes across the country. I know you all, many of you in Alaska and beyond, have these right in your backyard every day. Next slide, with the beautiful stream here and the mountains in the back. And next slide, where you start to see some buildings. I add all these in the beginning of many presentations because when I ask whether it's a graduate student class, PhDs, or other public health advocates, when I ask people to do an exercise with me and close their eyes and to think about the first couple things that come to mind when they think of environment or our environment, at times many of these pristine visuals come to mind, but it's very interesting how limiting sometimes that concept can be. Next slide. So many times when I ask people to give me an idea of what first popped in mind, they don't necessarily think all the time of these cute little cuddly animals. Next slide. Or these cute ones. You should be on the one now with the beautiful flamingo towards the top and the lion and the monkeys. Or next slide. The ones that have, of course, children and families. And that, again, is another way to frame the perspective that I'm bringing here today and that many of us are here on this call and do every day, the fact that children are susceptible to many environmental exposures and need to be protected. Okay, next slide. So the Children's Environmental Health Network, many of you may know us. We are a national nonprofit. We got our start out in the Oakland Bay area in the late 80s, and our mission from the beginning has always been to protect the developing child from environmental hazards and to promote a healthy environment. Our goals are to promote peer-reviewed research and to support that research, including the funding needed for such research, then to translate that research towards education and awareness activities and trainings, and then to promote sound child protective policies. So we consider those to be those with children at the center of all policy. And using those efforts to then better identify opportunities to improve children's health across various sectors, not these siloed approaches anymore, but cross-disciplinary type of efforts. So why the focus on children? Again, I won't spend too much time on this, but making sure I don't make any assumptions. We do know that children are not just little adults. That was a phrase that was coined way back in the beginning of this field. Children actually eat pound for pound more food and drink more water and juices and actually breathe in more air and in minute intervals than adults. So all of those place them as routes of exposure for exposure to harmful chemicals to their normal development. Also their behaviors, what are they doing? No fault to them, they're crawling on the floor, they're putting things in their mouths, they're exploring, as they should be. But unfortunately that behavior also puts them at harm's risk. And all of their systems, nervous system, neurological, respiratory, musculoskeletal, they're all still developing, even into their toddler years. So all of these place them at high risk for being exposed to different routes of chemical hazards that maybe adults that already have mature systems may not be so susceptible to. And their little bodies were not meant to metabolize these major harmful toxins in the first place. So a little bit of brief history. I'm sorry, I haven't been saying next slide. We're now on brief history at the top, where it says starting with the 1980s. I'll try to do better with that. In the 1980s, the field of children's environmental health, we started seeing more of a focus on environmental health impacts to children, which was very exciting. And there was the creation of the Childhood Lead Poisoning Prevention Program at the CDC around that time. And also there was a group called the Kids in the Environment Project that was founded. That actually was the precursor to what's now the Children's Environmental Health Network. In the 1990s, we started to see this very exciting growth of a movement, a better understanding that we can't just continue with business as usual, that we need to be considering vulnerable populations, of which children are one of a few, and thinking about our policies and our procedures and how we go about things and our standard setting in a much different way. So in 1992, the Children's Environmental Health Network, now a national nonprofit, was officially founded. And also key partnerships were happening around this time. The American Academy of Pediatrics, We Act for Environmental Justice out in West Harlem, New York, and many other environmental justice efforts that have been going on well since before even the civil rights movement. National Resources Defense Council published a very important, influential article, Intolerable Risk, Pesticides in Our Children's Food. From that, the National Research Council developed a study to then make sure that they could confirm the NRDC report called Pesticides in the Diets of Infants and Children, and that was also very groundbreaking. So what was found here at the end of the day is that our regulations on, in this case, pesticides in our foods were not at that time adequately protecting our children. And then, if you will, the field has just skyrocketed, which is great. There are so many more groups working on protecting children, even if it's not their exclusive focus, like our organization, it certainly is embodied and built into many well-respected community-level, grassroots, regional, state, and even some federal efforts. So we have seen advances in research in these 24 years or so of protecting kids' health since the Children's Environmental Health Network has been around. But I would also say that we expect to be, definitely filling much more on the landscape on our research front. We have many gaps to still fulfill. There are some policy successes, which I'll get into a little later, especially at our state level, but still not much protecting specifically that of children, especially on the federal level. We've seen increases in our resources and our partnerships, but again, many of that work is done in silos. We have school health happening. Now we have early learning happening even before K through 12 work. We have housing work happening and on, but not necessarily are all of those intertwined. So while it's been important to work exclusively at times, we have found at the national level it's much more effective if we can broaden and cross-fertilize. We get more done that way. We do know that there are anywhere from 85,000 to anywhere from 85,000 to 90,000 synthetic chemicals that are in our regular production and use in this country. We also know that those chemicals commonly are not adequately tested for their impact on human health, and then specifically not the human health of young vulnerable children. Next slide. We are now on how are children exposed at the top. There are different ways for exposure. Either a child can ingest, for example, paint chips, lead paint chips. That's one route of exposure. Or soil that's contaminated, or obviously contaminated food and beverages such as laced with pesticides or other contaminants. Inhaling, for example, lead dust is a concern. Skin absorption or eye contact is another way, and certainly through prenatal exposures. There's enough science available to show us and tell us that in many cases what a pregnant mom or even a mom or parent soon expecting to become pregnant is exposed to can then pass on through breast milk and other means as well. So obviously reproductive health is just as important here in exposure. Next slide. We're on today's emerging pediatric health challenges. So we know that we're dealing with early onset and longitudinal exposures in many cases and long-term legacy impacts when we're dealing with kids. We also know that in this day and time, we're dealing more with chronic illnesses than even what used to be more infectious diseases. And many folks, such as Dr. Dick Jackson at UCLA, the School of Public Health, and many others have actually gone so far as to say that we are possibly looking at the first generation to see a shorter life expectancy than parents due to their poor health status overall. So the alarm is definitely sounding right now. Next slide. You should now be looking at a graphic with 3 circles and words in between. I really like this graphic because I think it is an interesting snapshot of what we're dealing with. This is not easy. There are many confounding factors that have an impact on one child and that child's health and well-being. Social factors, social economic status, the level of crime, poverty, what is going on in the housing situation for that child. Those are all very important. Nutrition, the outdoor environment, what is going on or what exposures may be happening. Genetics, of course. Parenting and the availability of parents to get the kind of care and access to support that they need. And, of course, access to and having quality health care, all very vital. Next slide. So am I saying that the environment is to blame? Certainly not. But I do want you to understand that, exclusively I should say, but many of our health concerns are multifactorial. And if we are not considering that environment is part of the scenario in many cases, and at times can be a direct link, as the science shows us, then we're missing out entirely on many possible viable solutions for prevention. We know that a child's environment is shaped by, again, many of these different factors. It's not the cause of all, but certainly does play a role. Next slide. I like to use this slide because unfortunately it tells, I think, the story in a very graphic way. As you see, this is now the increase in environmental health concerns at the top. All of these arrows are going the wrong way. They're all increasing. They've started being monitored at different levels. Mostly, it seems here mostly in the 90s, except for obesity, started to be tracked in the 1980s at the end there. They're all going up, They're all increasing, and these are all within children and adolescents in particular. So this is yet another alarm of concern. Next slide. So when we look at learning disabilities, we've seen that they have increased almost 200% in diagnosis since between the 1977 and 1994. And you'll see some kind of older years in some of these slides, and I can say that there really hasn't been too much of a change in some of these. That's why they've been kept the way that they are. I wanted you to see from when some of these trends were started to really be tracked. In autism, we know that today 1 in 68 children, and this is coming from the CDC, are diagnosed with autism or on the autism spectrum of some sort. This is up from where it used to be 1 in 700 children. So our colleagues at the National Institute for Environmental Health Sciences had this debate back and forth when I was on their science council. Is it that we're better diagnosing autism, or is it that it's actually occurring more frequently? They finally came to the conclusion it's both. And so we know that just under about 50% of this is due to better diagnosis, but it doesn't explain all of the huge increase in the diagnosis. So we know there's something else there. This next slide talks about the declining of looking at lead. This is an arrow pointing down to your right corner, lower corner. This is just, many of you have probably seen this, it shows us that with pro-action in public health, before the 60s, we had extremely high rates of childhood lead poisoning in the U.S. for many reasons, lead being in our gasoline, lead in our paint, inevitably in a lot of our buildings, that type of thing. By taking proactive action, removing lead from our paint and our gasoline, we saw a huge reduction in the amount of incidence of high blood lead levels in children. But this is also to show we are not all the way down to zero yet. We still have a good amount to go. But it does show us with promise and gives a case example that when we act on the science that we have in a proactive way and invest, we do see positive returns. Next slide. This is talking about today's emerging public health challenges at the top. In lead, we do know we're dealing with roughly 500,000 children age 1 to 5 years with elevated blood lead levels, and that's over the reference level that the CDC has given us at 5 micrograms per deciliter. Sorry for the typo there. That's not also speaking to those that are underneath that threshold where we know there's also concern of any elevated level of blood lead relating to neurodevelopmental concerns. In asthma, we know that more than 10% of school-age children, or up to 10% of our school-age children have asthma, and it's the #1 reason for school absenteeism in school. That's also related to the amount of days off of work for the parents that have to be home with that child or take them for care. In obesity, we know that 1/4 of 2 to 5-year-olds and 1/3 of school-age children and adolescents are overweight or obese. And in Alaska, I was looking at some of the figures this week from the CDC. When you look at high school, I think it's juniors and seniors, Alaska is about in the middle area, if you will, where about a third of high school seniors, and it's very similar in many other states, are considered, in the overweight obese category. Next slide. This is the map of the U.S. Again, it's from, a little bit older, from 2007, but I will attest that unfortunately this hasn't changed too much. If anything, we're seeing states going in the higher range here, where they are documenting more and more of our children and adolescents falling into the overweight and definitely the obese category. Next slide. This is talking about asthma. I think we all know about asthma. We know that there are certainly some environmental triggers and allergens related to asthma, along with stress and diet and many other confounding factors. Asthma is very complicated. I just wanted to highlight this one study that was conducted, and it could also be applied to lead as an example, where they looked at the percentage of a particular disease category that could be eliminated if an environmental risk factor were reduced to the lowest feasible level. So if you looked at asthma, they found that the EAF, or otherwise the environmentally attributable fraction of asthma, is about 30%. And if that's the case, the environmentally attributable costs related to asthma range anywhere from $0.7 billion to $2.3 billion annually. It's ridiculous. And then there was an air pollution study that showed that an increase monthly of 1 unit of PM 2.5, a pretty bad air toxicant that helps to exacerbate asthma led to a $123 increase in charge to a patient that's hospitalized and a $47 increase in costs. I'm just trying to make the case here that there is an economic benefit to also focusing on primary, ideally, and then at least secondary prevention, which in asthma we are still not doing. Next slide. Trends in childhood asthma rates. Again, I'm sure I won't spend too much time. I'm sure you all know this like the back of your hand, but again, asthma is the third leading cause of hospitalizations among children under 15. This has been the case for many, many, many years. So it's extremely frustrating that we are still at this place. It's one of the leading causes of school absenteeism, as I said, and certainly there are some major racial disparities seen in asthma rates as well as lead poisoning, for example. Next slide. Childhood cancer is on the rise. It is the leading cause of disease-related childhood death in the U.S. Leukemia, the cancer of the bone marrow and blood, is the most common of childhood cancers. It actually causes more deaths than any other form of cancer among those under 20 years of age, and these are coming from the CDC and the National Cancer Institute. And we know that among children ages 19 or younger, cancer incidence rates actually increased a little over 0.5% per year from 2004 to 2008. And again, those trends have unfortunately continued. Next slide. This is also to help you understand, again, going back to that graphic with the multi-circles. We can't really focus just, again, in our silos of asthma and housing or housing issues exclusively, and on and on, if we are not also considering very seriously our childhood poverty concerns, because they overlap, especially when we get into health disparities and environmental justice issues. So unfortunately, we are on the rise again for childhood poverty as of 2011 when this graphic starts. But America's Health Ranking does these pretty frequently, and unfortunately that trend is not necessarily leveling off, so that should again be another alarm for us. Next slide. Environmental justice. We know that there are no group of people, regardless of ethnicity or social economic class, that should suffer disproportionately from any environmental health hazards, but unfortunately, it's still very much happening. In this one example here, I wanted to show that in East St. Louis, Illinois, a small city just outside of St. Louis, Missouri, on the Mississippi River, this is a city that's 98% African American. They have one of the highest asthma rates in the U.S. This could be one of many different states and cities in our country, especially in the Cancer Alley area down in the South that also have high risk of cancer and asthma. You had Monsanto, Pfizer Chemical, Big River Zinc, Cerro Copper. They've all operated in East St. Louis or in the nearby town for a while, so you have this long-term exposure route. Monsanto produced PBCs at their plant and deposited large amounts of PCBs and its byproducts into the area. These are known carcinogens, PCBs, even at low levels. So certainly there's no level that is safe for exposure according to the World Health Organization. So residents were exposed, many people were getting sick, many incidences of cancer, huge cancer clusters going on. So the residents filed a private lawsuit against these companies in 2009, but unfortunately as of 2 years ago, June, this may have been updated, June 2014, the cases were still pending. This is just one of many, many, many examples across the country where communities are rising up, doing the best they can, rallying together, getting even legal representation, but unfortunately still not even seeing any level of justice while they're still getting sick and their family and their kids are getting sick. This is truly not what this country is supposed to be about. Next slide. Today's emerging pediatric health challenges. Again, just as a recap, we know that many of the health problems that folks are facing overall are multifactorial. We know that environmental factors may play a role in about a quarter at least of those cases. And of course, when you look at people independently, it could certainly be higher depending on where they've lived, their zip code, that type of thing. Some common chemical exposures increase the risk of cancer decades later. So there is science to show this, certainly, and I will talk a little bit more about this in a bit. Next slide. So again, there are many sectors that shape children's health. The standards and the chemical standards and the regulations that are imposed on our townships they have implication. Our land use and our community design, how land was used previously before a school or a child care was put on that land is extremely important, for example, or even housing developments. Transportation policies or lack thereof, housing, education, on and on. These are all intertwined and have to be seen and a part of, in a very viable, intentional way, the field of children's environmental health if we plan to advance and truly increase our protections of children. Next slide. So getting into some strategies, I think this is really important to, you know, I don't want to depress everyone today, but, you know, I think I've made the case that we still have serious work to do, but now I want to try to turn a little bit and get to some of our strategies that we've been seeing that have been proactive and helpful in communities, and I believe can be modeled in many communities across the country. Integrated pest management. Many of you would know that integrated pest management is the ideal process where we are looking to promote to reduce pesticides and to encourage the best use where pesticides are only applied and used if it's the very last case scenario. So those would be extreme cases of infestation or something like that. And again, in an ideal situation like that, still the least harmful chemical possible that will do the job is used, and there's a very proactive process where children should not be in that area for anywhere up to 72 hours or more, and all this type of protocol. We know that those type of things are not necessarily happening when pesticides are applied. But ideally, when you use integrated pest management, you're reducing the interest of bugs and, if you will, pests to even encroach in a home or a school or a child care or building because you're reducing the things that promote them. Standing water, putting things away, especially food where it needs to go, making sure you're clearing around even the perimeter and foundation of a building, not just the inside. So there are certain techniques, and there's a whole field of this. Next slide. So I want to show you this example here in Monroe County in Indiana, where they used to spray pesticides like a lot of school districts do, especially on their athletic fields and around their building. They chose to begin to implement integrated pest management. They have 19 schools in their county, in their school district. By just implementation of IPM, they found a 90% reduction in the use of pesticides, 90% reduction in pesticide problems overall, in pest problems, and 90% reduction in pest control costs. And what they were able to do is they were then able to hire an IPM coordinator to then manage this program, because it had to be managed, and they still came out saving more money at the end of it, even with a full-time IPM coordinator for the county. I think that's an excellent example for a lot of our school districts across the country, and it really hits them hard in their pocketbook in a positive way. Next slide. Also, our Eco-Healthy Child Care program, about in a little bit, definitely promotes the use of integrated pest management in child care facilities across the country. And you can get to that through our website, which I'll give more at the end. Also, your state's agricultural extension program may very well hopefully be promoting IPM in your state. So that could also be another resource for you if you haven't been connected to your agricultural extension program. And if you need to be connected, I'm happy offline to help make that connection for you. Next slide. The Food Quality Protection Act of 1996, just to give you a little bit of policy framing here. This was a legislation that was passed at the federal level unanimously by Congress. It was amazing. That's rare. And the idea was to manage the amount of pesticide residue that is allowed to be on our fruits and vegetables. It was really the first bill that required the EPA to use risk management for children's health, really for the first time documenting where children's vulnerabilities were a part of the standard setting process. So standards for pesticide residue must explicitly consider the health and vulnerabilities of children. That was part of this. A safety factor of 10 had to be applied to adult risk levels if there's insufficient or unreliable data, so not just the assumption that the pesticides are safe, but rather the other side, that let's assume harm until otherwise proven safe. A little different than what we normally do. That pesticides must be tested every 10 years for health tolerance levels, and there was an incentivizing to develop and reduce risk pesticides to expedite approval process. There have been many times where we were certainly a part of this as a big coalition of getting this passed, but I will say there have been many times when this act has been at risk. of being not signed, not supported by the current, president at hand. So it continues to be challenged, and many of us just continue to try to make sure that it doesn't go away. But it's a huge, from where we stand, a huge step protecting kids on the agricultural front. Next slide. Land use, as I spoke a little bit about before. There are no national standards that exist for assuring that a child care facility, for example, or a school is not located on a site that could harm children due to adjoining or previous uses. And that's alarming. Next slide. Only New York and New Jersey have regulations on siting of child care facilities. And unfortunately, we find in this country, we tend to have our more stringent standards when, unfortunately, something has gone very wrong. So in this case, there was a Kitty College child care facility that was found in New Jersey where a lot of kids were getting very sick. Very sick. Come to find out that, unfortunately, that child care facility was built on an old manufacturing site that was a mercury plant. They use a lot of mercury. So that is one of these prime examples of also why now New Jersey has some of the most stringent standards, and we're hoping to get similar type of approaches modeled across the country, not only when kids get sick. Next slide. Looking at climate change, we know that 34% of childhood illnesses around the world are due to modifiable environmental factors, so i.e. climate change, and that's from the World Health Organization. We know that there will be casualties and trauma due to natural disasters. We will see increased morbidity and mortality of illness as we are seeing outside of the U.S. due to increased temperature and increased severe weather patterns. We will see increased risk of infectious and parasitogenic diseases due to increased rainfalls, and we can go on and on. We actually have a fact sheet on climate change and children's health on our website that we can also send around if that would be helpful, or if anyone's looking for it, just let me know. Next slide. So again, I'm trying to have these placeholders here because I know I'm throwing a lot at you, but there's so much to say. Exposures and environments during childhood affect health across the lifespan, and children's environments are shaped by decisions across these sectors. So this multidisciplinary approach to our work is very critical from where I stand. Next slide. Looking at preventive care, there is a 2011 study that showed that each 10% increase in local public health spending led to decreases in infant deaths, deaths from cardiovascular disease, diabetes incidence, and cancer incidence. The Urban Institute in 2011 found that American health system spends $238 billion annually in quote-unquote excess costs. That's defined as the difference between the cost of care for people with preventable chronic diseases and those without. And Trust for America's Health and the Robert Wood Johnson Foundation also showed an investment of just $10 per person per year. Improving community-based public health programs could save the U.S. up to $16 billion a year. So again, a lot of us are trying to not only make the basic science case when available and the basic logic case and the public health case, but certainly this economic case is there as well. It really is a win-win if we work towards preventing many of these preventable illnesses when it comes to our vulnerable populations, such as children. Next slide. So we have a lot of work to do. At the federal level, we know that we need to continue to work on chemical policy reform. All of these synthetic chemicals in our environment need to be absorbed. They need to be reviewed for use or non-use in a much more effective way. I've talked about, well, there is the Federal Toxic Substances Control Act, TSCA. You could easily have a whole college course on this on its own, but basically this is a rule that assumes a chemical is safe until otherwise proven not to be. It has also been a process where we were supposed to be evaluating health effectiveness or health concerns related to various chemicals, but there have been zero bans since 1990. So this has been really an inactive, broken system, which has been extremely frustrating for a lot of us. The EPA is forced to weigh health risks against economic costs of banning and limiting or phasing out a chemical. And so pretty much many cases they've been quite challenged to do the job that they've been set to do by this act. There are so many limitations that I have listed here. The standards are based on healthy adult males, not children. They do not consider the developing child vulnerabilities. They don't consider the different behaviors that I talked about in the beginning that cause children to be more vulnerable to various chemicals. And unfortunately, it only looks at one chemical at a time. All of us are exposed to multiple chemicals, if you will. So looking at one chemical and how it goes through the system of a human system is not an effective approach at all. Next slide. So I do want you to know about many states that are making strides, and I'm going to do a better job of looking into what Alaska has been doing positively too before my talk at the summit in October. But I did want to highlight some of these other states for you, and just in case you didn't know. And I believe that these numbers are even higher, but 30 states or more have or are considering toxic chemical legislation. And I'd say over 162 bills have been adopted by states by this point to ban toxic chemicals from products. I won't get into all of them, but so you'll have here California, Connecticut, New York, Vermont, and Maryland, and all the various bans of making sure that a lot of these harmful known chemicals and carcinogens do not end up in products on the shelves in these states. These are huge wins. So it's been very exciting to see states moving forward where at times the federal level has been stuck. Next slide. There's a Toxic-Free Toys Act. Albany County, I'm forgetting what state now this was, but there is a local legislator that talked about banning the sale of children's products within their county and banning those with chemicals such as arsenic, mercury, benzene, cadmium, cobalt, and lead. These are huge. So these are great examples for us to identify. These are not easy triumphs, but when they happen, it's extremely a huge case positive learning experience for all of us to be trying to model, what worked, what didn't work, what would you do differently when we're looking at other county and state legislator initiatives. Next slide. Many of you may know that there is now a new Toxic Substance Control Act, a revised act, if you will, called the Lautenberg Act. And it was until the Lautenberg Act where those basic provisions that I had just mentioned for the Toxic Substances Control Act were in existence, but these have now been amended. And it's the first amendment since 1976, which is pretty exciting. It's not perfect. There are many in the advocacy community that, have their concerns and wanted this to go further, but I will say that I do believe it's a step in the right direction, certainly. And it covers most products used in industry and commercial consumer products, but it does have its limitations. It excludes chemicals that are used in drugs, cosmetics, foods, and food packaging, such as those regulated by the FDA, and those regulated by pesticides that are regulated by the EPA. Again, there are advocate groups that are putting on day seminars related to this new TSCA Act, and if there's any of you interested in learning more about that or seeing some slides, I'm happy to point you in the right direction after today as well. Next slide. In this new act, chemicals are judged, sorry for the typo, solely on health risks, including vulnerable populations, which is very refreshing and much different than our current process. It requires safety review of all existing new chemicals. It increases EPA's authority to require industry to test its chemicals and avoids many past loopholes that were very concerning. It provides the ability to keep chemical information secret. That ability is drastically reduced where many in our manufacturing side of things wanted the chemicals that they're using to be secret, and we're trying to reduce that option to do so. And substantially, there is more money funding for EPA in theory, and partially some of that is intended to come from industry. There are some processes where there would be fees provided by industry. So that's been part of the problem, that there hasn't been enough of the monetary resources to allow EPA to do what they need to do. So again, I think step in the right direction. I think those of us in the advocacy community want to continue to monitor and continue to enhance this at every opportunity possible, but I would say a much better process than what we currently have, which is broken. Next slide. So the Children's Environmental Health Network, we do a lot. I wanted to give you some of the updates of what we're doing more recently and where you maybe can be engaged or learn more if you're so interested. We support peer-reviewed research through our conferences. We have an article of the month that we promote every month if you want to get on our communications. We do translation of that research into public health and policy implications that may be helpful to some of you and some of the work you're doing in your states. And we work on advisory boards and, again, support the increase of critical pediatric environmental health research funding. We put on these conferences every 2 to 3 years. Our next one, or our last one actually, was in 2015 on children, food, and the environment. Our next one will be this spring, April 5 through 7 in Washington, D.C., with a more general children's environmental health theme. And there will be call for abstracts being circulated in just a couple of weeks in September. We'll make sure that you all get that, and we would highly encourage many folks to consider applying to present. We conduct a variety of education and training programs to build awareness of the field. We traditionally have worked with healthcare professionals and have a curriculum just for healthcare professionals for them, as well as in their teaching curriculum that they can use. And we also have our Eco-Healthy Childcare program, which has been running over a decade now, which is very exciting. It's the only program of its kind that I'll get to in a little bit more that's training childcare educators on environmental health best practices. So we're excited about that. We also promote health in all policies, so this general idea that in the beginning of the policymaking process, we need to be considering the vulnerabilities of children at the very beginning, not once a policy is already in effect, trying to retroactively go back. History has proven that doesn't work, so we have some programs in that area. And we've been working on a blueprint, well, we have a blueprint for protecting children's environmental health, an action agenda that is available also on our website. It was a result of a wing spread retreat that we held almost 2 years ago now, where we brought together all different leaders and quote-unquote experts in different disciplines to give us input on, if you're looking at key themes, which I'll get to in a few minutes, you know, where should we be spending our collective energies? Where should we be spending limited resources and capacity for the field? So it's seen as a frame, a tool for all of us to utilize, and I would highly encourage all of you to be checking it out in some of the work that you're doing. Next slide. So our Eco-Healthy Childcare program is a program that supports childcare providers in creating settings that are as environmentally safe and healthy as possible. Prior to our program, across the board, there still is no standard national way of obtaining environmental health education as a childcare owner, facility manager, or childcare provider themselves. So it allows parents to choose facilities that are committed to creating safer and healthier environments. The way that we do this is there's many ways to get involved. If you're a center yourself, you can actually get our 2-year endorsement by complying to a checklist of best practice techniques. And if you aren't able to meet 24 out of the 30 best practices, we provide some guidance as to what you may do to then come into compliance. And then one has to renew every 2 years for this distinction. And we give them free marketing and help to promote them. And so that's great because they're a business at the end of the day, and it helps set them aside from other child care facilities in their neighborhood. We also have the train the trainer side of this program, where we're putting on workshops and trainings across the country for a wide variety of healthcare and licensing professionals in child care. We're also almost done with our online curriculum, so soon people will be able to do this online, as that's a much more sustainable way to do this and not just fly staff all over the country. Next slide. So I won't get into these, but in our health and all policies work, we have been focusing with healthcare professionals as well as in the early learning space. So this slide shows some of the successes we've had with key child care associations in the health and all policies realm, really working with their standards, making sure that they include environmental health standards, updating their environmental health standards, making sure that they have the best, most up-to-date science applicable that then leads them to the standards that they make that influence child care and child care licensing. So that's been exciting. Next slide. There are some examples within states that we've had some impact on health and all policies. So Pennsylvania's Green and Healthy Child Care Initiative continues to use our Eco-Healthy Child Care curriculum in their Keystone Stars program. So all of their child care providers going through that program get our curriculum, which is fantastic. Vermont is also interested in following Pennsylvania's lead and incorporating the environmental health curriculum into their what they call quality rating improvement program that helps to train their child care providers. And in New York, they're also moving and shaking. They have all kinds of providers, over 12,000 child care providers that have been trained, and also trainers that they've been training with a lot of technical assistance by our program as well. Next slide. We've also partnered with the Environmental Law Institute to produce a recent report on state policies that address environmental exposures in child care facilities. There's no other resource like this. So it's not a comprehensive review, but it's a general review that also gives us some ideas of success stories that could be honed in on a little bit more in the child care realm and looking at what policies would be most effective to truly protect kids much better than they currently are in licensed child care across the country. Next slide. I already told you briefly about this Wingspread Summit. This was a summit that we pulled together in 2015 that helped to pull together a vision for protecting kids, a current vision that is in the beginning of our blueprint, as well as the blueprint itself that's now available on our website. Next slide. This vision statement includes four critical areas here: mobilizing greater societal understanding of children's environmental health, creating knowledge essential for action, and using that action that we have to then protect and promote and have better tools and resources for trainings and education, marshaling the engine of our economy, hence a lot of the economic analysis that I've been trying to draw in even to this presentation, to make sure that we're achieving environments where children can truly thrive, and building the political will in our institutions of government for child-centered policies. Those are the areas, the themed areas that are in our blueprint, and then there are specific strategies that are identified within each of those key areas. So again, I would highly promote the use, and if it's allowable, I'm happy to send around the links to some of these resources after the call. Next slide. Here are some additional children's environmental health initiatives that if you don't know about, you might be interested to find out more about. Healthy Babies, Bright Futures. I know Charlotte Brody is another speaker that's coming to the summit in October. This is looking at, in essence, the first 1,000 days of a child's development and what might be some critical windows of opportunity to hone in on. I know that they have some state initiatives that they're working on. I know that they're working on reduction of arsenic in infant cereals, as well as a huge lead campaign and focus right now. TENDER, otherwise known as Targeting Environmental Neurodevelopmental Risks. This is an effort that's looking at 6 specific science-based known neurodevelopmental hazards and some proactive activities in a collaborative way to reduce those across the country. There is a Healthy Schools environmental health research agenda. This was developed out of a spring meeting that the Healthy Schools Network helped to promote that we partnered on. There is a national collaborative for a cancer-free economy that we're also a part of. This is huge. It's been going on for almost 2 years now, but in essence, it's, again, a multidisciplinary effort that continues to bring in more groups, that has a goal that in one generation we will see a transition from not just focusing on treatment of cancer, but acknowledging the environmental contributions to many forms of cancer and making sure that prevention is part of our efforts across the board when we're dealing with cancer. I've talked about our Pediatric Research Conference that will be held in April 5 through 7, and you'll hear more about that. And we are launching a Children's Environmental Health Day. This will be the second Thursday of every October, which is known as Child Health Month, moving forward. And the first one is this October 13th. We'll have lots of different ways through social media that all of you across the country can participate and really help to make sure that we sound the whistle on the need to protect kids from many environmental hazards. And those of you in the DC area can actually attend an event as we get closer to those invitations. Next slide. And I am officially done. I know that was a lot to digest, and I'm sorry if I was talking a little too fast, but I get excited for these kind of longer talks to kind of fit so much in, and hopefully I've intrigued you for some discussion, at least for the next 10 minutes or so.
Great. Thank you so much, Nse. And as you said, many of the topics that you touched on could be entire, seminars.
Easily.
Leads me to invite and turn the call over to Pam Miller, Executive Director of Alaska Community Action on Toxics, to tell us more about the summit that's coming up, the Children's Environmental Health Summit here in Anchorage in October. And then we'll get to our discussion.
Well, good morning, everyone, and Nse, thank you so much. We're so excited to welcome you to Alaska in October, and I think your talk is a great prelude, and I'd like to invite everyone to participate in the first ever Children's Environmental Health Summit, at least in Alaska, that will be held at Alaska Pacific University on October 5th and 6th. This is a statewide conference protecting the health of children at the top of the world. And we're really pleased to be bringing together nationally renowned scientists, Native and community leaders, children's health advocates, healthcare providers, parents, and others who really care about protecting children's environmental health. We hope to come out of this conference with a set of recommendations for actions in the areas of policy, research, healthcare, and we really have an amazing array of presenters and participants. And just to give you a little bit of a preview, in addition to NSAE, we're very pleased to note that we have such speakers as Allison Kelleher, who is a tribal doctor and MD here at South Central Foundation, Dr. Ruth Etzel, who is the director of the Office of Children's Health Protection at EPA, Maureen Swanson with the Learning Disabilities Association, who headed up the national program of tender that NSAE spoke of, Dr. Philippe Grandjean with the Harvard School of Public Health, Elise Miller, the director of the National Collaborative on Health and the Environment, Dr. Madeline Scammell of Boston University, Charlotte Brody with Healthy Babies, Bright Futures, and I could really go on. And Mayor Ethan Berkowitz will be giving an opening address. So this is very exciting. We have also a wonderful list of sponsors that include the National Institute of Environmental Health Sciences, the Alaska Mental Health Trust, the Alaska Children's Trust, Geneva Woods Birthing Center, Stone Soup Group, the Natural Health Center, the Pediatric Neurology Center, and Avante Clinic are among the sponsors. We urge you to register for this very important conference. We need your hearts and minds there to participate so that this conference is not just an end in itself, but we come out with a very practical and direct set of actions and recommendations that we can all work on together. So please go to our website to register and get more information, or give us a call. And the website is akaction.org. We still have some scholarships available, so please, if you're interested, we don't want funding to be a barrier to participation in this, so please contact us if you need any support for your participation. And thank you so much.
Thanks, Pam. Now, in our time remaining, we'd like to invite questions and comments from our participants. So if you'd like to ask a question or comment or make a comment, please press *2 to unmute your line. Please also state your name and affiliation. And we'd like to get to a few questions before we're out of time. So if you could try to be brief with your questions and comments, that would be appreciated.
Hello, this is Fran Solomon from the Evergreen State College in Tacoma, Washington. So I have a question about the Lautenberg Act. One of the concerns about this law was that it would allow for more restrictive state legislation to be preempted by the federal government. But I believe that some language was put in the law to prevent that. So could you speak to that?
Oh, thank you for the question. It's very good. And I will totally, in full disclosure, I'm still learning, quite frankly, still all the whistles and bells and concerns. But I have heard that generally in some of the meetings we've been in, that I know that there were some things that were originally there and then that at the last minute were stripped. So if that is the indication you're getting, I believe that is also true, that unfortunately that was those were some provisions that we all would have loved to have seen in there that were stripped a bit from that. So like I said, there are still a lot of folks that are not necessarily thrilled with this act because they know what it could have been. But to be honest, there have been so many efforts for chemical policy reform over the years and kids-safe chemical policy that have not gone anywhere, or that have not even moved to this level, that, it's unfortunate, but at times I guess it is what it is. But it's still, people are on the Hill saying that it's a very positive in that at least there are folks on both sides of the aisle that at least are having the dialogue, they're listening to each other, and by at least having this first act get passed, it seems as though history would show, in theory, that it should allow for opportunity for further growth and fine-tuning it. So some of those provisions that were left out, obviously people are keeping track of, especially groups like Environmental Defense Fund and the National Resources Defense Council, and a lot of their attorneys, quite frankly, are keeping close tabs on this, so that when the next conversation can happen yet again in the next Congress, depending on what Congress is up to, that in theory these would be ways to help fine-tune further. So sorry for the long answer, but I believe that is correct, that unfortunately some of those protections were stripped at the last minute.
Oh, sir, I want to clarify. I was talking about a bad feature of the bill. So
I know. Okay, sorry.
Very strong environmental laws. And under the Lautenberg Act, my concern is that the weaker federal law would preempt the stronger state law. But I think that some provision was made where a state could get around that. So that's what I was asking about. I'm
sorry for misunderstanding that. I do not know enough, to be honest with you, on that. But like I said, I am actually going to a few trainings myself, actually in the next couple of weeks on that. So if it is of interest, I'm happy to circle back. And I know that there are resources that are being developed, kind of fact sheets, if you will, trying to give myths versus facts. And if any of that would be helpful to this audience, or if there is a way to get out some of this information to those of you attending, I'm happy to do that afterwards to give a little bit more clarity.
Okay. Thank you very much.
Yeah. I'm sorry. Maybe I could add here, this is Diana, that we do have a call. Our next CHE-Alaska call is on September 21st, and it will be on the Lautenberg Act. So that is an opportunity to
Perfect. Perfect.
Yeah. Okay. I would like, Nancy, are you able to stay over just a couple of minutes so we can get another question or two in?
Certainly.
Okay. So again, if somebody would like to ask a question or make a comment, you need to press *2 to unmute your line.
Hello.
Hello.
Hi, this is Claire Barnett from Healthy Schools Network. And Nse, thank you so much. That was just a terrific presentation. And Pam, I'm so glad you're doing that. Just a quick comment. Nse mentioned that we had hosted a conference in June. We actually hosted 2 conferences in the last year looking at children's environmental health, and it's very much a research and a policy agenda. And we just backed that up with a new triennial report, State of the States report on data and policy regarding risks and exposures to children. So I encourage people to take a look at it. The report and the press release are on our homepage, healthyschools.org.
Thank you, Claire.
Thanks, Nse.
Yeah.
We have time for one more question. Anyone would like to chime in? *2 to unmute your line. Okay, well, I'm going to go ahead and wrap up. Nse, if you could definitely send me the resources that you were thinking of throughout your presentation, I'd like to provide those to folks in a follow-up email.
Wonderful. We'll definitely do that.
Okay, and as well as I'll be sending around the audio recording of today's call. So again, as I mentioned, our next call will be on Wednesday, September 21st, and we'll be on the Lautenberg Act, which is that new legislation passed by Congress in June that marks the first update to federal chemicals policy. And so you should be looking for a CHE-Alaska announcement with a registration link in the next week or so. And I want to thank everyone very much for participating today, and Nse for your time, especially given your long weekend and getting home late and everything.
Sure.
Yeah. And finally, just want to say, if you found today's presentation and discussion valuable, please consider making a donation in support of these calls. You can do so at akaction.org. And we really appreciate the support. So thank you, everyone. Have a wonderful day. We hope to see many of you at the summit in October. And you can call our office at 907-222-7714 if you have any questions at all. Thank you.
Thank you.
Bye-bye.